How high is too high for blood pressure? High blood pressure, also known as hypertension, is a common condition that affects millions of people around the world. It occurs when the force of blood against the walls of the arteries is too high, which can lead to serious health problems if left untreated. But how high is too high for blood pressure? In this article, a cardiologist will explain what blood pressure levels are considered normal, high, and dangerously high. Blood pressure is expressed with two numbers: systolic pressure over diastolic pressure. The systolic pressure represents the force exerted on the artery walls when the heart contracts, while the diastolic pressure represents the force when the heart is at rest between beats. Blood pressure is measured in millimeters of mercury, mmHg. A normal blood pressure reading is typically around 120/80ths of a millimeter of mercury. The systolic pressure should be less than 120 millimeters of mercury, and the diastolic pressure should be less than 80 millimeters of mercury. However, blood pressure can vary throughout the day depending on factors such as physical activity, stress levels, and even the time of day. It is essential to measure blood pressure multiple times to get an accurate reading and identify any patterns of high blood pressure. High blood pressure, also known as hypertension, is classified into two stages: Stage 1 and Stage 2. Stage 1 hypertension occurs when the systolic pressure ranges between 130,000 139 millimeters of mercury, or the diastolic pressure ranges between 80-89 millimeters of mercury. Stage 2 hypertension occurs when the systolic pressure is 140 millimeters of mercury or higher, or the diastolic pressure is 90 millimeters of mercury or higher. These readings indicate that the individual has consistently elevated blood pressure that requires medical attention and lifestyle modifications. Blood pressure levels that are dangerously high are classified as hypertensive crisis. This condition requires immediate medical attention as it can lead to severe complications such as stroke, heart attack, or organ damage. A hypertensive crisis is defined as a systolic pressure reading higher than 180 millimeters of mercury and/or a diastolic pressure reading higher than 120 millimeters of mercury. If you experience these high blood pressure levels, you should seek emergency medical care. It is important to note that blood pressure guidelines may vary based on individual factors such as age, sex, and existing medical conditions. Consultation with a healthcare professional, particularly a cardiologist, is recommended to determine the appropriate blood pressure targets for each person. If you have elevated blood pressure readings, it is crucial to take steps to manage and control it. Lifestyle modifications such as adopting a healthy diet, low in salt, saturated fats, and cholesterol, regular physical exercise, weight management, stress reduction, and limiting alcohol consumption can help lower blood pressure. Thanks for watching.